What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. Today, I have a new friend with me, and I take the liberty of calling him my friend just because I've been following him on social media, and I love the content that he shares and all the cool stuff he's doing. So it is my pleasure to introduce you guys to Dr. Joshua Roland. How are you?
I'm doing very well. Thank you for having me, Dr. Dasani. Excited to be here.
Oh my gosh. Such a pleasure. Such a pleasure. And as always, our listeners know I will not waste time reading bios. We will post all of that in the show notes. He is a pretty accomplished doc. He's done quite a few cool things. And I really want to jump into the meat of the matter so we can get as much information from this amazing MD who's been doing great stuff with sleep. So you are a sleep MD, is that correct?
Yep, that's correct.
And what prompted your journey into that specialty? Like, why sleep?
Yeah, I think like many of those who get into sleep, it wasn't really planned initially. I actually was a psychology major in undergrad, and then started doing work in clinical trials within sleep medicine, which really what sparked my interest in sleep is a clinical field from medicine standpoint, and really prompted me to go to med school. I completed that, and did residency sleep fellowship, and got out there, started doing it. So long road, and kind of happened randomly.
That's awesome. That's awesome. And there's a couple of aspects, and I know we kind of briefly chatted before we hit record here, that I wanted to pick your brain about. You do a lot of work around insomnia. Is that correct?
Yeah, that was actually one of the initial interests in sleep was, back to the psychology days and really looking at, how sleep or lack of sleep impacted cognitive function. And then looking at insomnia, which I think is such an interesting topic. It's so simple. It's something we can all relate to, but it's so complex. And many, many times insomnia is actually very multifactorial, and there's a lot to really tease apart. So it's something that many of us go through at some period of time, but it's always a challenge and an exciting challenge to kind of tease apart and get into the meat of what causes insomnia. So that really was kind of my start, is looking at insomnia. The clinical trials I used to work for were in pharmacotherapy involved in insomnia. So it's kind of my first passion with sleep medicine.
Yeah, let's dig a little bit into that. Yes, we all know what insomnia is, but give us a little bit of an insight into insomnia as it relates to your world. What do you look for? What do you see? How do you address this with your patients? And I know, CBT and all of that. So go into all of that for us.
Yeah, I think it's really interesting. And in terms of how we treat insomnia, it's a challenge where it really takes a lot of time, particularly on the initial visits, to tease apart everything that can go into insomnia. It's really such a unique, really encompasses the whole biopsychosocial model, where there's things from, our stress levels to our mood, to, our habits, to our medical conditions, comorbid sleep disorders. All these things go together for many people and factor into their sleep and lack of sleep in the case of insomnia. So I think one of the challenges is, how do we kind of tease this apart in a clinical model, which I think, many people who have suffered from insomnia and have seen a physician, it's really hard to do that on, 20-minute initial visits. So, there's logistical challenges there. There's, the challenge is just, again, kind of taking that whole scope into consideration. And then how do you drive treatment? Most of the time we really recommend CBT-I or cognitive behavioral therapy for insomnia, which I know you've done episodes on, and I'm sure your audience has some familiarity with, but it's really looking at cognitive behavioral interventions for insomnia. It's been shown to really work the best long-term, the best safety profile. Pharmacotherapy can have a role in certain conditions, certain situations. So there's a lot of nuance to treating insomnia, which makes it something that, again, a challenge that I enjoy doing. Again, I think the medical model is not always built for that, where many sleep clinics are set up, more to bring you in, maybe check for a few things, check for, do a sleep study, rule out or rule in sleep apnea, which can be a very important part of insomnia at times, some other conditions. But, it is a condition that is, can be a challenge to diagnose and treat.
And I know you do a ton of telehealth, correct, for this. Is this something that patients can seek help with and for via telehealth, or do you recommend in-person visits? Where do patients find most benefit from all of this treatment, even getting to the meat of the matter, or just modalities?
Yeah, so some of the challenge with not only diagnosing insomnia and teasing apart the different components, but the CBT-I that we all talk about and all really love in the field, it's actually there's not that many providers that administer CBT-I, so it's actually hard to get patients in to see a CBT-I specialist. I was trained in CBT-I and tried to do it as much as I can in my kind of brick and mortar traditional practice. Again, these are visits that take a lot of time, which I was always happy to do, but administration doesn't always want you to spend an hour session with with a patient kind of working on CBT-I. So we rely a lot on really psychologists, clinical psychologists who are trained in CBT-I. The issue is there's not a lot of them out there. There's a huge shortage in CBT-I providers, and there's also a lot of accessibility issues where those providers might be clustered around academic centers or hubs. So telemedicine is a great way to reach out and kind of get a lot more patients access to a CBT-I provider. They've done studies that actually look at more asynchronous and different models of telehealth for CBT-I, and found that some models, particularly CBT-I done telehealth with a psychologist, is just as effective as anything brick and mortar. So we know that telehealth is a viable way to kind of deliver this care, and again has this benefit of providing more access and getting more patients treated. Over that being said, there's a lot of nuance within even within that, where all the studies are kind of very different in the way people deliver CBT-I. So there's still a lot of clarity around what's the best way to deliver this version of care, this form of care to patients with insomnia. But I think it's a great starting point is get more access and get more people linked in with CBT-I to hopefully start improving their symptoms.
Yeah. So from a patient perspective, how quickly can we expect to see results? How, if I'm a patient that's working with either you brick and mortar or somebody else, what does a time frame look like for somebody that's obviously struggling with this? I can't imagine not being able to sleep. What is realistic for these patients?
Yeah, it's a great question. And, some of the exciting thing about insomnia is really every case is different. So it's a very variable answer. The exciting thing is it often doesn't take that long. So there's sometimes very low-hanging fruit that can really make a major difference very quickly, and that's very exciting. However, it also can take time to really change how our subconscious thinks about sleep and change behaviors and change circadian rhythms. Some of these things can take a little bit more time. So, many patients do experience benefits quickly, particularly if the correct etiology or contributors are identified. However, it's not to be discouraged, because many people, it takes actually weeks, typically even months, to kind of get things under control. Most CBT-I programs are typically around 4 to 8 weeks, kind of roughly. So I kind of use that as a good marker of when they should see some improvement, but very variable depending on the case, depending on what's going on. And again, depending on really the challenge of identifying correctly the different mechanisms and contributors to patients' insomnia symptoms.
Yeah, I agree. I guess that's where the taking your time in that initial appointment to, like you say, tease apart every little nuance and figure out where you can actually make the most impact in the quickest time, shortest amount of time for the patient helps. Switching gears a little bit, I know you do a ton of work on REM sleep behavior disorder as well. This is not something that I believe we've ever covered on this podcast. How frequent is this? How common is this? And what is this?
Yeah, so REM behavior disorder, a very interesting condition that we see in sleep medicine, where basically normally during REM sleep we should have atonia of our muscles outside of our muscles of respiration. So we should essentially be paralyzed during REM sleep. In this particular condition, people actually lose the ability to remain atonic during sleep, which sounds a little double negative there, but basically people have the ability to move during REM sleep, and that enables them to act out their dreams. So you get all these situations where patients are having dream content and it's manifesting as verbal or physical actions. And, sometimes it could be benign, where they're just kind of moving around, doing an activity. I had patients say that they're, fishing, and they kind of do the motions of fishing or other things like that. It can be more scary where patients are jumping out of bed and harming themselves on furniture. attacking bed partners. There's a major safety issue for bed partners, often with patients who suffer from REM behavior disorder. So, really interesting condition. It's one that requires an in-lab sleep study to identify, and basically we look at the muscle tone during REM sleep and see, is the tone normal during this sleep stage, or is there a lack of atonia? Certainly for behaviors and things like that as well. So really interesting condition. It can have a lot of impact on bed partner safety, patient safety. There's some interesting associations where we know that very often, not always, but very often, these cases will actually lead to things like Parkinson's or Lewy body with dementia. Dementia with Lewy body, and other neurological degenerative disorders. So this is often a very, very early sign of that, which brings a whole nother aspect to kind of managing those patients, kind of these discussions and how do we have these conversations where there's a very high rate of what we call phenoconversion from just the symptoms of acting out dreams to one of these neurological conditions. And there are exciting opportunities in that at some point. So if we ever find a way to modify those conditions, right now we really don't have a ton of way outside of maybe exercise helping a little bit. Actually, REM behavior disorder would be very exciting thing to kind of find out and then provide an intervention to help reduce the risk of developing those conditions, which is kind of on the horizon. I should mention as well, so again, not every patient that has these symptoms go on, to get those disorders. Certain medications can cause REM behavior disorder as well. SSRIs, antidepressants, and some few others can cause REM behavior disorder. So a really interesting sleep condition that, we're still learning a lot about and kind of figuring out the best way to, really manage there.
Yeah. So it sounds like a diagnosis is an in-lab sleep study. Causes you mentioned could be certain medications, right? Is there any genetic component to this?
Yeah, it's hard to say. I mean, the answer probably is a little bit, at least, right? Most things have at least some genetic impact. It's not that they're necessarily have pulled apart or identified, a lot of genes that are, super inherited. So it probably has some impact, but it's not something like other conditions that, you get tested genetically and you have. So it's not an extremely strong correlation genetically, but it's definitely possible that there could be a small component of that.
Okay. And then what does management look like for this? Because we know the risks associated with, like you mentioned, some patients could go on to have Parkinson's and such. These could be considered early indicators. But what does long-term management look like for this for patients?
Yeah, so the management usually involves pharmacotherapy, or very often involves pharmacotherapy. The medications we use, believe it or not, we actually use melatonin is one of the first line agents. Which many people are familiar with melatonin, obviously, at this point, and has a role there with circadian rhythm disorders. People use it for insomnia often, but it actually helps to reduce symptoms of REM behavior disorder. So very different way to use it, and we actually dose it a little different. It's usually a little higher dosing than we recommend for circadian rhythm disorders or patients trying to take for sleep onset. So that's one of the first line agents. We also sometimes use or often use clonazepam. That was kind of what we used historically, a benzodiazepine that also helps with those symptoms. And those are really kind of the main two medications. There's a couple situations where things like pamiprexol and maybe rivastigmine might have a role in some cases, but generally it's either melatonin or clonazepam. But then a lot of it too, kind of what we were talking about earlier, is actually behavioral, where we really talk about bed partner safety, making sure that you don't have sharp edges nearby or weapons or anything that could be dangerous when you're acting out a dream. Sometimes we recommend a bed partner to sleep in a different bed space if possible, if they're at danger. So kind of an interesting combination of medications and behavioral modification there, just to help to reduce the risk. And really the risk is injury to the patient and bed partner.
Yeah, certainly would be concerning there. When we were chatting earlier, we talked about telehealth, and you were mentioning your newest project that you're working on for CPAP compliance. And as a dentist, one of my alternatives that I offer to patients, and one of the main reasons they find somebody like me for sleep, is because they're non-compliant with their CPAP, or they, whatever the reason may be. We're like, well, yes, and that's why my sleep MDs refer patients, because the patients don't use it. So tell me about this new project of yours. What are you working on? How can we expect this to change the face of sleep treatment compliance for our patients?
Yeah. So, sleep apnea same thing. It could look at it very simply where it's a collapse of the airway, but it also can be very complex as well, where there's different locations in the airway and different presentations and contributors to sleep apnea. The nice thing about CPAP is it doesn't really matter where in your airway things are collapsing, whether it's upper airway or, somewhere else in the anatomy. It blasts air in there and makes this pneumatic stent. We call it, basically keeps the airway open. So it can work pretty well if patients can use it. So, it's obviously a challenge at times to wear this mask on your face, blowing air, and then try to sleep. So, really one of the main issues with CPAP is not necessarily effectiveness, but it's compliance. It's getting people to be able to tolerate the treatment. We can make a great treatment, but if people can't use it, it doesn't really matter, right? Or if their sleep is just so poor with the result of treatment, it makes it, maybe not worthwhile to that patient. There's a lot of other options that are emerging. Oral appliance is, I think a great opportunity to really address a lot of patients and improve sleep apnea symptoms in a lot of patients. We need more people like yourself who are dentists who are interested in sleep. I think it's very important. We're more aware, implantables being used now, so hypoglossal nerve stimulation and things like that. But CPAP is still the gold standard. So really the idea of this new project is how can we improve this experience? So often I think patients are really just given a CPAP and kind of sent on their way, and they don't really have maybe all the tools to help them be successful with using their CPAP. So, really what we're working on doing, we're kind of getting different techniques and different even products kind of together and combining that with a kind of a coaching experience and really trying to help patients, set them up to have higher success than they've had kind of traditionally, and see if we can improve that compliance and get more patients successfully treated for their symptoms of sleep apnea.
And I'm assuming this is all via telehealth again, so they have easier access to you or whoever else is helping them with it.
Correct. Yep. So it's going to be through telehealth. The company is going to be called Sanusom. It's incorporating, again, a lot of different techniques from all over the place. Some things from a physician named Dr. William Noah, develops a couple pretty interesting work around different mask types and other products that we're going to kind of incorporate. So I think it'll be, hopefully something that, again, really helps move the needle in terms of compliance and, adherence and getting patients to be able to use their therapy and address their symptoms there.
Awesome. As we start to wrap up today's episode, you have a book. Tell us about it.
Yeah, I do. I saw, looking at your website before, I saw you did some great work on some books, particularly pediatric books. I had a project I worked on with a former mentor of mine, Dr. Roberta Liu, and it's a book basically kind of walking through how a child would get a sleep study. So it's called I'm Getting a Sleep Study. And it kind of happened. I remember getting my tonsils out as a kid, and we had a book that, kind of read about it and got me excited to get my tonsils out and made the experience a positive one instead of one that could be scary. So we really wanted to do the same thing with a children's book. So I think it's a great book, hopefully to help kids and also parents in terms of preparing of what to expect going into a sleep study, just to make the experience better for really everybody. And yeah, it was exciting to kind of get that out. I think the biggest excitement of it is my niece ended up getting a sleep study, and she, we gave her the book beforehand, and she found it very beneficial. And she was actually playing sleep study and putting tape on her face and things like that beforehand. And then in the study itself, she's telling the tech, what's going to happen next. And so, it was really rewarding just to hear her go through that experience and, hear other parents and kids go through an experience that's hopefully a little bit better due to the book. So
yeah, this could certainly be such a valuable resource. I know we're going to order some for our practice, because when we have kids that need to go out for sleep studies, it can be scary. As part of my sleep education, I got to spend some time in a local sleep lab that the MD that I work closely with runs, and it was some amazing amount of information. And there was a child that was having their sleep study too. And now that I think about it, I was like, I know it would have been so much more easier for that child to have gone in, having read a book like this, knowing what to expect. Oh, there's going to be like so many tapes, or they're going to do this, or, but I think that's amazing. Before we end, and I always like to ask all my guests this, what are your top 3 tips for anybody that may be dealing with any kind of sleep issues? It could be insomnia, it could be any other sleep disorders. What are your top 3 tips?
So one, I would definitely seek medical care, particularly if you have any signs of, sleep apnea or a lot of other things out there that people aren't even familiar with. REM behavior disorder is mentioned, restless legs. So, if you are having trouble sleeping, I would try to seek a board certified sleep specialist just to make sure there isn't something more serious going on. Sleep disorders are very underdiagnosed, so it remains a major issue. But then a lot of things that you can do pretty simply right away are really just consistency is one of the most important things with sleep. Getting consistent habits, getting consistent sleep time, wake time. Also, the hour before bed, I think is very crucial, or hour or 2 before bed. I think this day and age, we have so much going on, whether it's work, our recreation, our phones, social media, that we turn these things off and then expect just to go out like that. And, that's not really how our bodies and minds are meant to work. So always kind of tell patients, think about our ancestors where at night it got dark, same time every night. It wasn't a lot to do. Things kind of got, processed and we were able to wind down. And that's something we're kind of lacking now. So trying to get that period back a little bit, I think can go a long way.
Yeah. And I tell patients that if you put your phone down and you fall asleep right away, well, you're sleep deprived. We got a different problem to solve then. So
very good point.
Yes. One question, and I know I should have asked you this. Where can people find your book?
So it's on Amazon. I should have a link or something somewhere. I think it's linked through my Instagram somewhere. But yeah, if you Google, I'm getting a sleep study, Joshua Roland or Roberta Liu, I think it should pop up. So it's out there somewhere. Might have to search a little bit for it, but
okay,
happy to get you a link there if you need it.
Yes, we would love to drop it in the show notes. We will make sure to include all of that. How can our listeners find you, work with you, connect with you? What is the best way?
So main way right now is either social media, typically Instagram. My Instagram handle is Sleep Dr. Roland. I will admit I'm a little sporadic of getting in there, so I do apologize to anybody who reaches out and I'm not able to accommodate their message. But it's typically the best way to reach me. I try to check it at least periodically, and you do a little bit.
Perfect. And we will have his Instagram handle in the show notes as well. Well, thank you for taking your time today and sharing all of this amazing information with us. I know I certainly learned a thing or two. I appreciate you. Thank you so much.
Thank you. Thank you for having me there. Appreciate it.
And to our listeners, as always, share this episode. Make sure you leave us a review, and I will see everybody next time.